Well, good afternoon, everyone. I'm MLA Shane Getson, the MLA for the area, and it's Lac-Saint Anne Parkland, but we like to call it God's country out here. And if you're looking at it today, you're seeing why. I would like to acknowledge that we're on Treaty 6 territory. It's home of the Nakota Sioux, the Cree, or the Blackfoot. No, I shouldn't say the Blackfoot, I should say the Cree, and our friends and family are right next door to us in the Alexis First Nation, as well as Alexander and Paul. The name of the lake, literally of Lac-Saint Anne, is known as God's Lake in the native language, and it's been a place of healing for a number of years. And I think that this is very fitting that we're here to open up a new facility today and looking at just that, some more healing for good folks in the area and also across the province. With us today we have Premier Smith, we have Minister Williams, we have Minister Turton, we have the Reeve of Lac-Saint Anne Parkland, or Lac-Saint Anne I should say, Reeve Blakeman, Councillors Nick Gerlich, Councillors Lovich. We also have Lindsay Haig and Bill Caldwell, who will be delivering marks. So it's an honor and privilege again to be here today, and without further ado, I would like to have our Premier come and take the podium, who's a lot more polished than I am at these events. Thank you, Premier.
Thank you. Thank you. Well, now I know why you always call your constituency God's country. You're being quite literal on that. So thanks for the education, the geographic lesson. I appreciate that. Thank you, Shane, for hosting us here today. And good afternoon to everyone. I'm very pleased to be here with my colleagues, Dan Williams, who you'll hear from in a moment, as well as Cyril Turton, our Minister of Children and Family Services. And I am pleased to be here alongside some of the people who are at the forefront of the work to bring people out of addiction and into recovery. We're all aware of the impact of mental health struggles and addiction and how deadly and devastating it can be. Too many Albertans are familiar with this pain, or with the despair of watching loved ones sink beneath the weight of these challenges. Change is long overdue, and while other governments pursue more ways to make illegal drugs more accessible, we're taking a different approach. We're giving people the opportunity to turn their lives around, because that is true compassion. Leaving people to suffer is unacceptable and cruel, and it's why we were clear in our aims during the election campaign last year. Our government was elected on the promise to improve healthcare delivery, and especially in mental health and addiction. And we've moved quickly to increase access to the supports that give people a new lease on life. We eliminated user fees for publicly funded treatment. We funded 10,000 additional spaces so that more Albertans can use detox and treatment and recovery services. We've made medication-based treatment for opioid addiction available on demand through the virtual opioid dependency program with no fees and no wait lists. We've created same-day access to affordable and accessible counseling services through Counseling Alberta, which you can reach through 211. And now the third of our 11 planned recovery communities is up and running. I'm delighted to say that the Lakeview Recovery Community has opened its doors to welcome its first clients. This recovery community has 75 beds, which will allow men struggling with addiction to regain their health and to rebuild their lives in peace and safety. They'll be able to stay for up to 1 year and with access to an incredible range of services designed to help them start over. The goal is for each client to leave drug-free and ready to begin jobs or training with the help of strong connections close to home. But they're not the only ones who will benefit from this community. As we continue expanding treatment options across the province for Albertans, we must find and train more professionals to run facilities and programs. So the Lakeview Recovery Community will also host the Recovery Training Institute of Alberta. This will be a provincial training hub for addiction recovery staff. Students will get hands-on experience in addiction treatment, these services through a teaching hospital model. And we will need every single graduate, because 8 more recovery communities are at various stages of planning and construction. And 5 of these projects are being built in conjunction with partnerships with First Nations and Indigenous communities across the province. Each of these initiatives is part of the Alberta Recovery Model, a holistic system of care that embraces prevention, intervention, treatment, and recovery. This is about giving Albertans the chance to heal and reclaim their lives by breaking free from addiction. Everyone who's suffering deserves compassion so that they can leave the past where it belongs. And thank you to the ROSC Solutions Group for providing that by running running the Lakeview Recovery Community. Thank you as well to all the staff who will deliver on the promise of the Alberta Recovery Model. Thank you as well to the council members who are here as well supporting this incredible initiative in your community. And most of all, thank you to everyone entering Lakeview. You have the courage and the strength to change, and I admire that. And I'm looking forward to your stories of transformation and success. And now I would like to hand it over to Minister Dan Williams to share more with you about the details.
Well, good afternoon, everybody. And Premier, thank you so much for being here. And MLA Getson, thank you for welcoming us. Reeve Blakeman, thank you for having us in your constituency. And RSG and the residents, thank you for having us here today. There are 24 of you now. So we're already underway with this recovery community. And I could not be more honored to be a part of your story, that healing story that you have. The truth is that in Alberta, like across Canada and North America, we have addiction in our communities and our families, and that addiction runs rampant and it causes carnage and chaos and destruction. And Alberta knows we need to have a response to that. And we need to have a response that works. And that's why Alberta is articulating the Alberta Recovery Model. That Alberta Recovery Model is in practice right here, right now. I spoke to one resident today who came from the therapeutic living community, the Therapeutic Living Unit, also run by RSG, in one of the correctional facilities in the province that we've established, and a direct handoff from there to here, where this individual is one of the leading members in our community here, and hopes to eventually, to fully go all the way through the continuum, end up in the training institute that is here, right here at Lakeview, so that we can have the continuum of care in action in one individual's life. That's going to restore an individual back to being a brother and a father again. It's going to install another individual as a productive member of our community again, somebody that has faced down the alternatives of what addiction looks like and saw carnage and death and pain on one side and instead chose the culture of life that is embodied right here at this Lakeview Center that is so important in each of our 11 recovery communities that we're building. I want to pay particularly thanks, given our site right here, to the McCullough family, of which I know there are a number of members here today. This institution that Alberta's had for so long, the McCullough Centre, is gaining new life again. And I happily was reading an interesting excerpt from Ed McCullough, who the centre's named after, and will continue to live on, being named after a recreation administration building here. He said, "I started planning on breaking some land. In June, I borrowed 3 horses and a walking plow, and we broke about 1.5 acres below where the recreation center now it stands. The next year, we had enough vegetables to last over the winter." That pioneering spirit that was true in the community built by Ed McCullough and his entire family and all those who worked at the center for so long is now living on in the community that we have created here with these first 24 members. Now, these 24 members are the start of what will be a 75-bed facility that have multiple phases as they go through in the Alberta Recovery Model that is based on the method of community is method that has been highly successful internationally, and we are going to replicate here across all of our different recovery communities in the province. We started 3 years ago with $21 million in renovation, where we dealt with mold in cabins, flooding in past years, asbestos, and built a new dining hall. And now we have, as the Premier mentioned, zero-cost access for Albertans for long-term, high-quality care, individual and group therapy, skill development, building relationships. All of these are incredibly essential for what it looks like for someone to come out of addiction and live that life in recovery. And we are planning to see over 300 individuals go through a facility like this at Lakeview, every single year. And that story of one individual or 300 is how we build the Alberta model and the continuum of care from start to finish. As we see that carnage and that devastation across our province, as we see more and more families and individuals affected by addiction, we know that there's only one moral response, and that is to do what healthcare does best: give life-saving treatment and help the healing process. And that's where our government has stepped in to the tune of hundreds of millions of dollars, that we can build facilities just like this one and operate them so that we can have more Albertans returning to their families, returning to our communities, and being Albertans in full commitment to community again. And I couldn't be more proud to be a part of that today. With that, I'm going to ask Reeve Blakeman to come up and offer some remarks from the county. Reeve?
Well, as Shane said, welcome to God's country, beautiful Lake St. Anne County. We were so happy to hear that this government decided not to mothball the McCullough Centre and to take it and turn it into the recovery centre that it needs to be and what we need. And we're proud to be proud of that community. It's very important. We're so glad that the heritage lives on of the centre itself, and we're very proud to be a part of it. And without the collaboration of the government and all the other municipalities, everybody around, it wouldn't have happened. And again, welcome, thank you, and take care.
Hello, good afternoon. I'm Lindsay Haig, Executive Director of Lakeview Recovery Community. We welcome everyone here today. The establishment of Lakeview Recovery Community is a testament to the Government of Alberta and the Ministry of Mental Health and Addiction's unwavering dedication to enhance recovery services across the province. Their exceptional stewardship and commitment to developing innovative recovery programs are unparalleled in Canada, highlighting a robust support system for individuals on their journey to recovery. Premier Smith, Ministers, thank you very much for being here and supporting throughout the implementation of Lakeview. The opening of Lakeview today represents a significant step forward in providing essential recovery services to those in need, ensuring that individuals from across Alberta have equity of access in receiving high-quality, recovery-orientated care tailored to their needs. The programme here at Lakeview is fully funded by the Government of Alberta. Therefore, Lakeview will provide this comprehensive, evidence-based care at no additional cost for any Albertan. As those that are with us here today can see, Lakeview Recovery Community has been transformed into a state-of-the-art 75-bed men's facility, providing safe, secure therapeutic environments. This site is unique. Being spread across 40 acres will provide many unique opportunities for those that choose to access here. Residents can stay at Lakeview for up to 12 months. They will have the opportunity to stay in one of our 3 to 6 bedroom homes, and we have excellent facilities on site, including community hall, group rooms, social activity areas, a wellness centre, and brand new dining hall and kitchen behind me. At Lakeview, we'll be delivering the evidence-based therapeutic community model. The therapeutic community, or TC as we call it, has been delivered across multiple countries across the globe over the last 60 years, with extremely positive outcomes. The model focuses on the whole person approach. Therefore, treatment is varied and tailored to that individual need. It includes a highly structured programme which ensures community as method and social learning, promoting learning from one another. Our programme includes various group learning opportunities and individual therapy, health and wellbeing initiatives, mutual aid, alternative therapies, cultural and peer support, as well as vocational training and employability support. The programme and its environment has been designed for residents to be nurtured in development and growth, and to achieve lasting, sustained recovery. We, myself, and the entire Lakeview staff team and community residents are honoured to be part of the Alberta Recovery Model and this pioneering initiative. We look forward to making a meaningful and positive impact to the lives of our residents and their families as we move forward. Thank you.
Good afternoon, everyone. My name is Bill Caldwell. I'm the Executive Director of the Recovery Training Institute of Alberta. And we are so grateful for everyone who came out today and to welcome you to the site. And thank you as we sort of announce this major partnership between Lakeview and RTIA going forward. Today marks a significant milestone in our collective journey towards forging a stronger, more resilient community dedicated to supporting individuals in their recovery from addiction. I'd like to begin by echoing my friend Lindsay's sentiments and expressing our deepest gratitude to the Alberta government for their unwavering support of our project. We're particularly honored to have Premier Smith and Mr. Williams here with us today. Your dedication to improving the lives of Albertans, especially those facing the challenges of addiction, has been instrumental in making this vision a reality. Thank you for your leadership and your commitment to the well-being of our communities. The Recovery Training Institute of Alberta was born out of a shared belief that there's not a one-size-fits-all pathway to recovery. There's numerous pathways to recovery. There's as many different pathways as there are diverse individuals who walk them. Through this partnership with Lakeview, we aim to create an environment where knowledge, understanding, and compassion intersect. I've had the opportunity to work in treatment and recovery all across the country over the last 20 years. And what I can tell you from that experience is that the quality of care that is accessible to people who are struggling has been wildly variable at best. Together here, we're building a community where shared language and shared understanding become the cornerstones of effective support, ensuring that those who work in this field have a common foundation of knowledge. In a world where addiction is often misunderstood, it is crucial that we create spaces where the many pathways to recovery are recognized and respected. By coming together, professionals, community members, and those with lived experience, we're laying the foundation for a more inclusive approach to recovery, one that honors the unique experiences of each individual. Through this collaboration, we have the opportunity to engage learners with not only the information that they need to thrive, but also to take what they've learned and witness it in action inside a functioning, healthy recovery community. We have online courses offering a strong base of knowledge about the world of recovery and about the Alberta model. We offer interactive training opportunities through workshops and weekend intensives that combine traditional learning with that opportunity for hands-on experience. We can take people directly from that class and set them up into seeing exactly how it works in practice. And that makes a huge difference in this teaching hospital environment. We have the capacity here at Lakeview to have courses for everyone working within a recovery-oriented environment, whether that's counselors, maintenance staff, medical staff, support staff, or leadership. We're creating a supportive network that empowers individuals to reclaim their lives and thrive, and helps those working within the field to deliver the highest quality of care in a way that also supports them. As we move forward, we'll continue to work together to strengthen the bonds within our community, guided by the principles of compassion, respect, and a shared commitment to the well-being of all. Thank you all for being here today and for your ongoing support. Together, we're making a difference and we're making history in Canada.
Well, I usually get as nervous as a long-tailed cat in a room full of rocking chairs when I go up to a podium when I have to read from the script here, but I want to share something that's right from the heart. When I was 17 years old, there was a program that the Alberta government had at the time, and it took high school kids, and it allowed them to go to the Henwood Treatment Centre, where you got to spend a week in treatment, in recovery with folks that were going through that program, both in Narcotics Anonymous and Alcoholics Anonymous. One thing as a young man at an early age that I found is that addictions knows no bounds, knows no race, knows no colors, knows no socioeconomical status. It's a disease. There's issues and challenges that we all go through, and the light at the end of the tunnel there is that everybody has hope. There's a spot for you, and I'm so glad that our government recognized that. Premier, Minister, thanks for doing that. Thanks for taking that chance on Albertans. Thanks for putting this place back together. And similar to Minister Williams, I did have a chance to look at some of the history of the McCullough Centre. It was from 1941 until 1977, and Ed McCullough had written a number of notes in there that gave a little bit of a color and a background and a tapestry of our history. But the theme that we're talking about today, I think, honors the spirit of what was intended back then, that everyone's worth it, work as a community, work hard, pull together, and there's a spot for you at the end of this. So thank you so much for everybody coming out today for doing this. We're going to have an opportunity for some pictures here that'll be taking place. We'll have an opportunity for a bit of a scrum as well, but we're going to get a chance, and I'm standing in the way of a big ribbon cutting ceremony right now. And I'm sure that we want to really light this up, open the doors officially, and get after that. So without further ado, we'd like to move on to that next section. Thank you.
Getson. We're now going to go to our Q&A portion. We'll take some questions from the media. Will be one question, one follow-up. Please state your name and outlet for the record. Shailan, I see you lined up, so go ahead.
Thank you so much. Shailan Skolsky with CTV News Edmonton. Question for either the Premier or the Minister. Wondering, now that we've seen 2 of these centres in operation for over a year, what evidence do we have that these recovery communities are working? What evidence can you share in terms of the number of people who have, quote-unquote, successfully graduated, and how long have they been able to stay sober?
Yeah, so we're collecting the data through my recovery plan. We need longitudinal data. What we see when we look at reports from other programs touting their success, if they don't look at data beyond 1 or 2 weeks afterwards, which is often the case when you look at some of these different reports, then it's not very helpful. You need to know 6 months, 1 year. So we really want to see people stay in sobriety for at least 2 years. The data internationally shows that when you have 24 months of sobriety, you have very, very high chance of long-term lifetime life in recovery. So we're still collecting it. Anecdotally, before that comes out, these men and others are the evidence that we point to. The return on investment is every one of these individuals. I was at the Red Deer Recovery Centre just this last spring. There was an individual who graduated who was visiting again with his mother and his daughter to those individuals because he'd created a sense of community there. I mean, my heart was overfilled with joy to see that kind of opportunity, that he swears up and down that he would be dead if he were still on the street and if it wasn't for the recovery community. So these are the kind of stories that are turning themselves into hard empirical data as we continue to collect that in a longitudinal fashion.
And as a follow-up, I have heard from those working in the addiction sector who say getting Albertans into these existing facilities has been extremely difficult. They're told that the wait lists can be as long as 6 to 8 months, and that individuals suffering from addiction as well as bipolar and schizophrenia are having difficult times getting in. Can you confirm what the wait list is and whether or not there is a set of criteria for people to get into these centers?
Just to jump on, I'll have Dan answer that as well, but just to manage expectations, the Red Deer Recovery Community opened in May of last year. The Lethbridge Recovery Community opened in the fall of last year. We've had therapeutic living units that have, I believe, about 20 to 30 people in our corrections facilities, and they've staged their opening over the last year. So to Dan's point, you have to have 2 years of data in order to be able to get the kind of long-term results that we're looking at putting into our research. But that just shows the demand. We have 11 recovery communities in total that we want to build out, about 75 beds each. So we have yet to build out the entire system. That's part of the reason we recognize the demand is enormous, and we have a number of different ways to be able to manage the demand in the meantime. So I would just ask people to be patient as we continue to open up these facilities. We also don't want to rush people along as well. We know that a 28-day recovery program, although that have been popularized, the long-term success means that you may need to be in a program longer, up to a year in the programs that we have. So that's part of it, is we want to make sure that we're giving people enough of the supports that they can really ensure their success. And I'll turn it over to Dan to talk more specifically about the waiting list.
Thank you, Premier. So there's no global number for how long it takes to get into any one recovery community across the province because, number one, it could be unique reasons why an individual would want to go to one particular recovery community close to family, or maybe they want to get further away from the triggers of where they were in community where they were using in their active addiction before. Also, we don't have all of them reporting back in the same way. Of course, we have our own recovery communities giving us estimates because it varies daily based on the availability of that day when someone moves out. Obviously, we try and coordinate lead time if someone's coming from a TLU, one of our correction facility therapeutic living units, into a recovery center. We can line those up as best we can. But there's even a number of private providers that don't necessarily feed back that information to us. Anecdotally, I've heard reports that some waits are as low as 2 weeks or less if circumstances work out. And I've heard numbers on average as high as into a month or so. So individual circumstances could be higher based on someone's particular needs and what center they do or don't want to go to. And we try and facilitate what we can when we're coordinating through our continuum of care.
Next question, please go ahead.
News. Premier, the previous UCP government had closed the center that was previously on this land. Just kind of why the decision to close one facility and then open another?
I'll turn it over to Dan to give you a little bit of the history.
Sure. So there was a huge need for renovations at this facility, and the thought was potentially to mothball it. As it became clear that we could keep what was a very good facility here operating with approximately $21 million renovation, bring it up to what is a world-class facility when it comes to recovery centers, continue to keep that same tradition that Ed McCall and his family brought alive in plowing those fields and opening up acres to be productive and give back to the community and help people heal. It seemed like the obvious place for us to continue doing that. And this is going to be a huge opportunity for us. This is unlike our other recovery communities where this is not based just in one facility, but as you can notice, dozens of cabins which have been renovated now, no longer mold or asbestos in it, which we had to make the decision to go forward. We wanted to keep that healing tradition alive that this institution and this place has had for so long. And we have a need for more spaces, as you heard earlier, across the province. We're laboring to make sure that we have as many recovery treatment spaces available in the province. This is that real-life example. It's the province putting its money where its mouth is. It's us saying we believe that healthcare should heal people if they're in addiction and not facilitate it. And this is a great good news story for those who get to go through it and for the community who get to see that.
Minister, with the training center here on site as well, are there any challenges staffing, this center, the previous two centers, just how hard is it to staff? What's the need for workers?
Well, I mean, there's always a challenge staffing across the province and across North America when it comes to healthcare. But I'll say this, at our recovery conference last year, where we had over 2,000 people come from across Canada and, to be honest, internationally, speakers in the UK, from the United States, and all across, even the White House had sent individuals there to speak on their behalf. People are excited about the Alberta recovery model. And we had resumes dropped off at the Future Recovery Alberta AHS booth there from BC and from Saskatchewan and all across Canada. There is an excitement that we can take recovery in Alberta and make it what addiction treatment should be. Something that tries to heal and care for individuals and not just facilitate more addiction. Across Canada, it's been too long that we haven't seen more growth in this area, and staff are excited about that. We also know that it's good to grow our own, so that's where the Recovery Training Institute is going to play such a big part all across the province. And most people who are recovery coaches have lived experience. We need to make sure that we have a way to formalize those skills, that they know something that maybe you or I, who haven't had that lived experience, don't understand as intimately. We want to have RSG be able to bring them up to that really important professionalized standard so that they can go and do their work and help others live that life in recovery, that life-giving opportunity at recovery again.
Thanks, Minister. I don't see anyone left in here in person, so we're just going to jump to the phones. Operator, can you put through the first caller, please?
The first caller is Lisa Johnson from the Canadian Press. Please go ahead.
Oh, hello. Thanks for taking my question. This is for the Premier. Premier, school boards and teachers I'm sorry, this is off topic. They're, at the moment, officially in the dark as to whether you're going to have policy in place requiring parental consent for kids in schools changing their names or pronouns. Are you able to confirm that the Education Ministry will roll this out as legislation in perhaps October, November, or December, and that you will preemptively invoke the notwithstanding clause to do so before advocates challenge it in court?
Well, I can confirm that we will be bringing forward legislative proposals in the fall session. Of course, I don't want to presuppose what the outcome of those deliberations would be, but there will be lots of time to be able to get the policies in place and to implement them. So we have to make sure that we have that robust discussion in the legislative session in the fall, and that will happen this year. Yeah.
Lisa, do you have a follow-up?
Yeah, thanks. So just to confirm, that won't be in place in time for the school year, but it will come in the fall. And my follow-up is regarding Minister Scow. Last week, I was asking him similar questions. He declined to offer details about how exactly a ban on trans athletes in women's sports will roll out. Same kind of situation. Will it be legislation, regulation? But it appears his ministry has told the National Post that this will be legislation. Can you tell us, can you confirm that to me now, and whether this will affect kids in K-12 sports beginning this school year, beginning in September, and perhaps shed some light on what your plan is for enforcement on that policy?
Right. I mean, once again, we have a legislative process that we have to go through. So that'll be, we go back into the legislative session, I believe, on October the 28th. Our intention is to bring forward those policies that need legislative approval in the fall session. And so that will be both the ones affecting school and healthcare as well as sports. And once you've passed legislation, regulations have to be implemented, and then there's a moment of proclamation and then implementation. So not September 1st. We have to, I don't want to preempt the discussion that we're going to have, but there will be legislative discussion that happens on this in the fall, yes.
Thanks, Premier. Operator, can you please put through the first call, or the next caller, sorry.
The next caller is Jonathan Bradley from Western Standard. Please go ahead.
Hello, Premier Smith. Thank you for taking my question. So, as you likely know, during the Olympics, there was a controversy that erupted pertaining to Algerian boxer Eman Khalif with her chromosome not matching with biological sex. What do you think about that?
Well, look, I'm sure many people who were watching the Olympics have their own opinion, but what I'm focused on doing is forming policy here in Alberta to make sure that sports are fair for women who are, and girls who are born female, meaning the biological sex that's reflected on their birth certificate. And we also want to make sure that there are also more co-ed divisions so that transgender women and men can also have meaningful ways to participate in sport.
Okay. And since you are talking on the policy front, you did say that you would be bringing forward policies about restricting transgender women from competing in certain sports. What are the particulars of that policy that you'll be bringing forward?
We're wanting to make sure that those who have their biological sex being female have the ability to participate in women and girl-only sports. That's the intention behind the program, and Minister Scow is working with the various divisions and various sports entities to make sure that is an option, but also to make sure that we have options for transgender women and transgender men to also participate in co-ed divisions.
Thanks, Premier. We have time for one more question, so operator, please put through the caller.
The next caller is Tim Brooke from CTV News. Please go ahead.
Thanks for taking my question, Premier. Just a quick one, maybe a double-barreled question. First of all, just your comment on what sort of impact a potential rail stoppage would have in our province. And secondly, I'd love to just know what your comments, or what your conversation rather, has been like with the feds as far as them maybe stepping in to make sure this thing doesn't happen.
Well, I can tell you it would be devastating to have both of our major rail lines, both CPKC and CN, shut down at the same time, shutting down all rail transport in the country for anything longer than a couple of days. I've spoken with the executives of both of those rail lines, and you have to imagine that anyone who is producing anything for transport by rail, if it starts backing up, they've got to stop production So it's pretty clear to me that this is not something that can continue on for any length of time. So I'm doing my work as well as the immigration minister federally is doing his work in contacting all of the players. I'll be reaching out to the Teamsters as well to see if there's anything that I can do to impress upon them how important it is for them as well as CPKC and CN to get to stay at the table so that they can get to a negotiated agreement. The impact on the entire country, all of the labor force, both union and non-unionized, it can't be understated. It would be extraordinarily damaging. I understand that CN has still not fully recovered from the port strike, as a for instance. That was a shutdown that I believe lasted 6 weeks, and they're still facing the issues of the diversion of product away from the port as a result of the uncertainty. And so that's what happens, is that you end up chasing away a lot of the business, which then ends up as a net reduction of jobs for everyone. So it's not something that we want to see. And I have also asked the federal minister to be prepared to reconvene the legislature, the parliament, so that there can be a vote on a couple of things. Maybe a vote to ensure that binding arbitration means work stoppages cannot exist while binding arbitration takes place. I think that the previous decision with WestJet threw some uncertainty into that one lever, so I think that needs to be clarified in law. But they also need to be prepared to do back-to-work legislation. Because this, as I say, this is not the kind of thing, with both of these rail lines shutting down at the same time, impacting every conceivable level of production that you can imagine, from food to energy to forestry and beyond. This is not something that can continue and linger on for weeks.
Thanks, everyone. I believe Tim does not have a follow-up, so that concludes our announcement today.
Thanks, everyone.